going to talk about feline hyperthyroidism and how it affects your senior cat. So there we go. So these are two cats who are not hyperthyroid. These are my own Rex cats. But if you ever wanted a cat that typically looks hyperthyroid, a Rex cat is a good example of one. Not that we can ever say that any animal looks like they have a disease, but they have certain characteristics that are common in hyperthyroid cats. So we're going to talk about some of those. So why is that a challenging disease? What's challenging about it? Well, first of all, it's common. So that can make things easy to treat or can make it harder to treat. In this case, it makes it harder to treat because it's something that's difficult to treat conventionally. There's a lot of side effects of the conventional treatment. And also a lot of our older cats have other problems. So that can make it hard to diagnose it accurately. And it can also make the cats have more troubles with the different conventional medications. And it's challenging to treat holistically as well because it doesn't always respond as well as we would like. So which cats get this? So first of all, older cats, they can get it as young as the age of 7. The average age is 12. It's funny that there's less of it in some purebred cats. Now this may just be it's Siamese, Burmese, Persian, Abyssinian, Tonkinese, and British Shorthair. So that doesn't mean you should go out and get one of these if you don't ever want to have hyperthyroidism. It may be that they have other problems that they're more prone to. We don't really know why there's this lower incidence. There is an increased incidence in cats that are eating canned food, and that may be due to substances that protect the lining of the cans, like the bisphenols. So what is this problem? So in 98% of cats, remember in the hypothyroid dogs, we said that it was an autoimmune destruction of the thyroid gland that happened. In this case, it's a functional thyroid adenoma. And an adenoma is a benign tumor of the gland. Now, sometimes I tell people it's a benign tumor and they go, oh, good. So everything's gonna be fine. Well, benign means it doesn't spread. That means that you don't get little adenomas all over the cat's body or anything. It doesn't mean a happy kitty because these kitties have really high levels of thyroid hormone, which is not good for them. And 2 to 5% of them will develop a malignant tumor, which will increase greatly in size and could potentially spread, though in point of fact, they don't. And we don't know why cats get this tumor. The cats have decreased production of a protein that suppresses excess cell growth. So, and they also have a gene that can cause normal cells to become cancerous in some cats. And it's also possible that that oncogene is turned on more by the iodine level of the food. Some of the cat foods contain up to 10 times the required amount of iodine. Other ones are really low levels. So really high levels, really low levels may both cause a problem. And some environmental toxins are found at elevated levels in their blood. Things like flame retardants and substances that resist oil and water and other organic pollutants. So keep your environment clean, and for a number of reasons, not least of which is this. There's a whole lot of other reasons too. So what do these cats look like? And let's remember with anything we talk about with clinical signs that we can't say that any one cat is going to look like anything. For instance, we know that our hypothyroid dogs, we think of them as fat, slow, lazy, bad skin, but that isn't all of them. And that there can be ones that have perfectly normal activity and are normal weight, but have behavioral changes. And similarly with cats, you can have animals that don't have these signs that still have hyperthyroidism. So most cats have a lump. And if you're going to check your cat for a lump, so if you can see me, what we do is we pick up the cat's chin, and then you take your hands and you run it down on either side of their trachea. And that's the thyroid furrow right in there. And 80 to 90% of cats are going to have a lump in that area. Now, 20% of normal cats can have a lump in that area too. So don't count on it as oh, you got hyperthyroidism. You can't use it for a diagnosis, but it can be an indicator. 95% of cats show some weight loss at some point in the course of the disease. And up to about half of them eat more than they should. They have excessive appetite. So this is a pretty common sign that they're skinny, but they're eating like a cat, like a hyperthyroid cat, and losing weight. Some cats actually have decreased appetite, and this may be due to the toxic effects of the excess thyroid hormone. So if they're eating less, it doesn't mean they aren't hyperthyroid. And there are behavioral changes that are seen in about a third of the cats. And that can be restlessness, anxiety, noise sensitivity, increased vocalization. I had one patient that ate plastic, too much grooming, things like that. So it can be a lot of different changes there. Other clinical signs are increased thirst and urination. And this can look a lot like diabetes or kidney disease, which is why, again, you don't diagnose things based solely on the clinical signs. Cats can get diarrhea and they can get vomiting. And this is because of the effect of the excess hormone, that because the metabolism is going up, the effect of the excess hormone on their body. And this can look a lot like a lymphoma, which is a cancer of the intestinal tract, or inflammatory bowel disease. Again, this is why you need to find out what the real problem is. About half of the cats will have heart signs, and that usually is elevated heart rate and sometimes a murmur. And sometimes they can have respiratory signs, which usually is things like coughing and panting and rapid breathing. It's not a major part of the picture. So how do we find out by the lab evaluation that they actually do have a hyperthyroidism? So when we go to the labs will test total T4. This is when your vet says, we did the T4, and they may call it TT4, they might call it total T4. If it's over this level, which in the US, we use the micrograms per deciliter. So if it's over 4 micrograms per deciliter, that's strongly supports the diagnosis of hyperthyroidism. If it's, there we go. If it's greater than 2.5 micrograms per deciliter with a free T4 measured by equilibrium dialysis, and always ask your vet, how is the free T4 measured? Because that makes a big difference. Of greater than 50 picomoles per liter, that also is highly suspicious for the hyperthyroidism. And then if cats are dodgy on both these, they're sort of between the lines on both of these sort of things, then we might also want to take in the TSH. So the thyroid hormone here in the neck produces, the thyroid gland here in the neck produces thyroid hormone because it's stimulated with thyroid stimulating hormone. So if it's producing a lot of this thyroid hormone, the thyroid stimulating hormone should be suppressed. And if it isn't, then your thyroid stimulating hormone is really low because the body's perceiving these levels, then that also is suspicious for hyperthyroidism as well. So again, this is stuff that you shouldn't need to worry about. Your vet should be evaluating this and talking to you about this. Thyroid scintigraphy is a way of giving the cat radionuclides that make the thyroid hormone glow. It's really cool to see these because the thyroid hormone shows up. If it has a tumor in it, it's really bright as opposed to a normal one, which just looks much smaller and lighter luminescence. So other things that happen because of the high thyroid levels to the body are because of this increased metabolic rate and the hormones' toxic effects in the liver. You can have other effects. For instance, because there's stress, you get changes in the red blood cell picture. You can get a slight increase in your red blood cells and a change in the kinds of white blood cell proportions. You can get elevated liver enzymes, and that's because there is a direct toxic effect of the excess thyroid hormone on the liver. It's not good for the liver. It's not a health food. You will often see elevated kidney waste products. Now, the kidney function in cats with hyperthyroidism is a matter of extra concern. Because hyperthyroidism speeds up the metabolism, kidney function can look better than it actually is. So some of these cats won't have elevated waste products. And when they are treated with the conventional medication, which slows down their thyroid function, then they develop kidney or show signs of kidney disease. So that is why you have to be extra careful if they already show signs of kidney problems, because that means these cats are already in a very tenuous state. And that's a urine specific gravity that's lower than 1035 is also indicative of kidney problems. So when you treat a cat conventionally, about 30% of all conventionally treated cats develop kidney failure within the first month of treatment. And we suspect that this can be maybe because these cats needed the higher metabolism in order to function well, in order for their kidneys to function well. We don't really know, but it's certainly suspicious that their kidneys were functioning well, and now you decrease the thyroid function and now they don't.